This clinical paper shows that patients that had a Regeneten implant for full thickness tears had a dramatic reduction in the time it took for them to go back to work. The Camacho paper from 2024 was a randomized controlled trial prospective study that focused on patients that had full thickness tears 2.5 centimeters or less and had an intact rotator cuff cable. The paper looked at 60 patients that were split into two groups. The first group had an ankle repair and the second group had just a Regeneten with no repair. The paper was followed up at 2 years. They did an MRI at 6 months, 12 months, 24 months. They did a biopsy at 6 months. They looked at patient satisfaction and how quickly the patients returned to work from the treatments. The results looked at a number of different areas. The first one was re-tear rates. None of the patients in both groups had any re-tear rates or tear progression. The biopsy showed that the patients that had Regeneten had highly aligned tendon fibers, little to no inflammation, compared to the group that had a repair, had a lot of scar tissue formation, had some mild to medium inflammation and fibrosis. The return to work on average was significantly faster with Regeneten at 90 days versus the repair group that was 163 days. The patients that received Regeneten had less pain scores at 6 and 12 months and had greater satisfaction scores at 12 and 24 months compared to the group that had a repair. And most importantly, each patient that had a Regeneten implant had complete defect regeneration, meaning all of the tears that were there previously were now completely filled in by new tendon tissue. The conclusion from this paper was that patients had better tendon quality, had better patient satisfaction rates, and also returned to work a lot quicker than the group that had the repair.